and welcome to VLAN IAS. Today we are going to discuss the editorial discussion and daily news analysis. The topics taken are comprehending public health and the scam hotline is damaging Indian banking. This is relevant in GS paper 2 and in GS paper 3. Our first topic is comprehending public health. This is relevant in GS paper 2 in governance. If a nation wants to achieve the prevention of disease or the disease preventions and also in the promotion of health, we have to focus on the planned investments in the field of health and education. Recently, the Chief Minister of Tamil Nadu has articulated the vision that is for the decentralized district level health management. Now, Tamil Nadu is ahead of most other states in socio-economic development, and this is because of the high priority they given to the health and education by the successive governments. So this is a case study. We have to focus that if we want to achieve the promotion of health or the disease prevention, we have to focus or we have to put the priority in our health and education system. We can go back to the history. During the time of British Raj, the doctors are mandated to report 24 notified communicable disease. Communicable disease and non-communicable disease are there. Communicable disease means this will spread to other persons. The examples of communicable disease include chickenpox, smallpox, and also typhoid, some viral fever. And these are communicable disease. And non-communicable disease means hypertension, cholesterol, diabetes, and certain cardiovascular diseases. These are examples of the non-communicable diseases. During the British Raj, doctors have to report it. That was a mandatory to doctors to report every case of 24 notified communicable diseases to the health officers. How they will notify this? By means of they enable the public health department to detect, count and counter the specific diseases in order to control the outbreaks. Document all data. 1897 Epidemic Disease Control Act. This is an important act which have extraordinary powers in case of public health as well as the epidemics. So recently this is invoked, means in 2020 to face the COVID-19 pandemic. Now we discussed about the British Raj time period. So after the independence, India assigned the public health to Ministry of Health. The issue happened here is disease surveillance was improper. So India became notorious for not collecting or verifying data on the diseases or cause of death. After the independence, public health is assigned to the Ministry of Health. They didn't follow the disease surveillance and the causes of death, means the data collections were improper and this led to the further complications. So once after the disaster occurrence, National Disaster Management Agency, that is NDMA acted for the functional public health infrastructure. It is for the public health would have forecast emergency. Health must be managed like an asset. We know that if there is no health, there will be no wealth. The definition of health consists of mainly two parts, that is the subjective data and the objective data. Subjective means it is the thing or the concept that is perceived or felt by patient, and the objective means the things observed by the doctors, staff nurse, in short, the persons other than the patients. In objective, this is validated by means of evidence. So in subjective data, this is evidenced by the verbalization of patient. Patient will tell about health status, means if they feel the pain, then they will communicate like the pain, mild pain or severe pain, and also they will tell about the nausea, feelings of nausea or anxious or the vomiting tendency or giddiness. So the health consists of two parts, Subjective and objective. Subjective, that is the physical, mental and social well-being. In objective data, it consists of absence of disease validated with evidence. People are conflict between public sector healthcare with public health. So the public sector healthcare as well as public health, these two systems are focusing on the health promotions or the improvement of health indicators. So their main goal is to keep the citizens healthy. Public health have a primary purpose or the primary goal. This is the disease prevention in the community level. So from the community level, that is social and environmental disease determinants as its primary purposes. Public health is targeting on the disease preventions mainly through the social and environmental disease determinants. So these two are the major interventions undertaken by the public health. The primary purpose is the promotion of health. Epidemiology means it is the study of the diseases and it is a major foundation science of the public health. During the COVID-19 pandemic, we lacked the functional epidemiology. So the lacking of functional epidemiology which adversely leads to the inadequate forwarding plan. So what will happen? If the forward planning will be inadequate, if the forward planning is inadequate, then it will lead to the inappropriate COVID-19 take care or the management of the pandemic. And India has good epidemiologists, but they just use their expertise predominantly for the research and teaching. So it is high time they used this discipline for the managing the public health, the disease surveillance and the epidemiology. These are the two sides of the same coin. So as like the epidemiology, disease surveillance is very much important in case of the health sector, because we need to assess the conditions or assess the cause of the infections or the diseases, and we have to plan the measures, then we have to implement. After all, we have to take the evaluations. To follow these steps properly, we have to focus both the sides of the same coins, means the disease surveillance and the epidemiology. It provides the real-time information for the action, and later it analyzes the data and facilitates the planning, that is the assessment, planning, interventions or the implementations and the evaluations. These are the process of healthcare sectors or the process of health services. We know that during the British time, India had lots of presidencies. So one of the presidencies is Madras. So Madras alone retained the legacy of the Public Health Act. So later, this was the Department of Public Health and Preventive Medicines, that is DPHPM, which continues since 1930. So after the state reorganization, the Tamil Nadu, which assigned primary health care to DPHPM. So after state reorganization, Tamil Nadu assigned primary health care to DPHPM. So primary health care means the PHC. This is the main grassroots level healthcare sector, and this is for the promotion of health and the prevention of diseases and for the surveillance. And the secondary healthcare is to the Department of the Health Services. That is, the primary healthcare goes to the DPHPM, and the secondary healthcare which goes to the Department of Health Services, that is the DHS, and the tertiary healthcare is to the Department of Medical Education. So after the state reorganization, the Tamil Nadu is assigned to the primary, secondary and the tertiary healthcare, and the primary goes to the DPHPM and secondary to the DHS and tertiary to the DME. And these primary, secondary and tertiary sectors have its directorate within the Ministry of Health. Tamil Nadu is moving forward for the greater investment in health and education. So this is after the achievement of the population stabilizations, and this population stabilization is mainly achieved by the planned activities. So now Tamil Nadu can moving forward for their greater investment in the health and education with assured perceptual and high order returns. In 2017, the National Health Policy, it recognizes the emergence of robust healthcare industry which is estimated to be growing at double digit. India, when comparing with the public health sector, the private tertiary care is providing more facilities. It also providing the medical tourism, and it includes Ayurveda, Siddha, Unani involving in the private tertiary care, and which is include the world class surgical and the medical interventions, and it attract the healthcare seekers even from the developed countries. So it promoting the tourism. So this is an important or the major aspect in case of the medical professionals in the private tertiary care. And paradoxically, our citizens are forced to pay for services that are due to them as legitimate human rights. Tamil Nadu. Tamil Nadu was the first to eliminate the smallpox. So Tamil Nadu, the Indian state which eliminated firstly, that is the smallpox, guinea worm, polio, measles, and measles mortality, and the first to document the Japanese encephalitis, dengue virus type 1 to 4. Dengue virus have the types of 1 to 4, which is majorly firstly reported in the Tamil Nadu, and Tamil Nadu also reported the Japanese encephalitis and the HIV, hepatitis B infections of North Arcot district, and had a district level disease surveillance model that pioneered the pulse polio immunizations. In order to prevent or eradicate the diseases from our society or from our community, we had to promote the immunization. So if we want to promote the immunization, we have to take a district level measurement or the surveillance. Then it will eradicate the further complications or the diseases. There is a monthly health information bulletin is called NADHI, that is NADI. It widely appreciated globally. It was undervalued nationally. If we want to eliminate the significant diseases, we need the data about the diseases, means how we will collect these data. So we need the wide application of the ICE, that is the information communication and the education system, and also it includes the wide penetration of the mobile phones, means if the mobile phones are more available, then the state can easily revive and revise it, means the data. They can collect the data, they can analyze it, they can plan interventions, and they can evaluate the things or they evaluate the data and they evaluate the methods they put, and further they can analyze the issues. So utilizing these electronic data collection and communications, every district in Tamil Nadu, it is to become a potential national leader in the systematic data collection, analysis and disease preventions, and for the outbreak control and credible recording of causes of death. So this is the important fact or the important step in case of the healthcare sector. Now Tamil Nadu have to do the universal healthcare and maximizing the public-private partnership, because we know that the private healthcare sector have the worldwide recognition, means it is promoting the tourism also, and lot of people from the developed country also coming to the private sectors. So it will enhance the foreign investments. So the Tamil Nadu have to maximize the public-private partnerships. We now need to design an equitable healthcare delivery system for everyone. So in order to achieve the equitable health delivery system, we have to maintain or maximizing the public-private partnership. It is now for the administrative machinery to put in place a health management program consisting of public health and universal healthcare in Tamil Nadu. There are some associated challenges with the public health systems in India. So first one is the lack of primary healthcare services. We have public primary healthcare model in India. This existing model have limited scope. Example from our community too. In our locality, if we give a thorough examinations about the public healthcare or the community healthcare or the district hospitals or the taluk hospitals or the medical colleges or multiple specialty hospitals, if we assess all these systems or all these levels of hospitals or the healthcare services, we can see some specializations are there. The specializations are mainly to the pregnancy related. That is the OBG departments. It includes the obstetrics and the gynecology. And also the child healthcare departments, that is the pediatric. And some aspects is go to the geriatric care. And furthermore, if we go inside deeply, it will lead to some communicable diseases is there, but in general aspect only. So the major activities or the government schemes and major activities, all these things are mainly related to these vulnerable sections. So this will lead to a limited scope in our society. Means in case of the healthcare system. So even when there is a well functioning public primary healthcare center, only services related to the pregnancy care, limited child care, and certain services related to the national health programs are provided. So this represents only 50% of all morbidities for which people seek care. Morbidity means infections or the associated diseases. The major comorbidities include the diabetes mellitus, hypertension, cholesterol, and coronary artery disease like cardiovascular diseases, further respiratory systems or renal systems. So these are the main comorbidities. And the next challenge is the supply side deficiency. Supply side deficiency means the poor health management skills and lack of appropriate training and supportive supervision for the health workers. This prevents the delivery of the desired quality of health services. The supply side deficiency means the healthcare system is mainly related to the resources. These resources is the human resources. Challenges coming from here are the poor health management skills. If the person is qualifying from the universities or the educational institutions which is not qualified according to the medical institutes, or which is not qualified according to the data or the criteria, then it will lead to the poor training. And also when we come to the hospital, sometimes there is rivalries are between the supervisors or the staff. So and also the lack of support from the superiors, and these all lead to the prevention of the delivery. Means the desired quality of health service will not be delivered to the patients or the community. And next one is the inadequate funding. So inadequate funding means the expenditure on the public health funding has been consistently low in India. If the expenditure is low in our public health, so it will lead to further issues in our healthcare field. Means we can't provide or we can't supply the adequate health care quality or the correct treatments to the patient. So it will lead to the further increasing of the morbidity and the mortality. The issue is the overlapping jurisdiction. Means there is no single authority which is responsible for the public health. Here we can learn that the healthcare system have primary healthcare system is the grassroots level. After that CHC is there, district hospitals are there, then the private hospitals, public hospitals, medical college. So we can form an hierarchy here. So first one is the primary healthcare center, community healthcare center, district hospitals, medical college. Before that it consists of private hospitals, public hospitals. So the overlapping jurisdictions are there. There is no single authority responsible for the public health that is legally empowered to issue guidelines and enforce the compliance of health standards. These all come to the district health services, and also there is national family service is there, family planning means national family planning measures is there. So all these things have the overlapping jurisdictions. This all comes to the Ministry of Health. So lots of bias are there because of these overlapping jurisdictions and the suboptimal public health system. It is challenging to tackle the non-communicable diseases. Non-communicable diseases are mainly include diabetes mellitus, hypertension, thyroid. This will not spread to other persons. This is called non-communicable diseases. Otherwise, communicable disease means the chicken pox. Like that diseases, it will spread to other persons. So which is all about the prevention and the early detection. It diminishes the preparedness and effective management of new and emerging threats such as the pandemic like COVID-19. COVID-19, it is an emerging disease or the new threat to our society. So the suboptimal public health system will lead to the inappropriate management of the new diseases like a COVID-19 pandemic. So we have to take the steps. Enabling the preventive care. So enabling the preventive care, it is to promote the preventive care. Preventive care means first we have to identify the cause. So before going to the treatment, we can take some measures in order to prevent the diseases. If in case we have to prevent the mosquito-borne illness, we have to take some measures like the cleaning of the surroundings and promotion of the dry day celebrations. So all these things will do is coming under to the preventive care, and also we can provide the health educations awareness programs to the communities and the families. And the union government has announced the conversion of the primary care centers into health and wellness center. So PHC will be converted into HWCS. HWCS means Health Wellness Centers. This is much more advanced than the PHC. Usually PHC consists of 1 or 2 doctors, and it just supports the baseline diagnostic evaluations like X-ray, ECG, and will refer the patients to the higher level medical level. And these HWCs means the health and wellness centers will act as the pillar of the preventive care. So it is to act the HWC as the pillar of the preventive care and gateway for the access to the secondary and tertiary health services. So before the introduction of the HWCs means the healthcare and wellness center, before that there was PHC. So from here the patients are referred to the secondary healthcare sectors or the services, and then to the tertiary healthcare services. So after the introduction of the HWCs, it acts as the pillar of the preventive care and for the gateway for the access to the secondary and tertiary healthcare. So from here only now the patient can go to the secondary healthcare services or to the tertiary healthcare services. The issue happening here is already we have less expenditure is providing for the healthcare system. So after the introduction of HWCS, we have to provide extra fund through the corporate social responsibility, bringing behavioral changes. So we know that nowadays people are focusing more on the junk food items, means the fast food items are they preferring both. So it will lead to the further spread or the further occurrence of the non-communicable diseases like the diabetes, hypertension, and further cardiovascular diseases like the coronary artery disease. So we have to bring some behavioral changes, like we have to aware the people about the importance of the eat right, sleep right, and maintain good hygiene, as well as exercise, and also for the adoption of healthy lifestyle. So these are necessary for the prevention of the diseases. In order to catalyze the people's participations for the healthy India, there is a need for the Swasth Bharat Jan Andolan. So it is on the lines of the Swachh Bharat Abhiyan, the cooperative federalism. So this given the major role that the states have to play in creating strong healthy systems across the country, and the allocations provided by the finance commissions can become the critical catalysts for the transforming the nation's health. So, and the state government should be incentivized to invest in creating a dedicated cadre for the public health at the state, district and block levels. So we know that from the grassroots level we have to focusing on this. So from the block level and to the district and to the state. So in order to maintain these cadre for the public health, the state government must have to be incentivized, and the more funding. Public health should be increased to at least 2.5% of DGP envisaged in the National Health Policy 2017. And the creating a nodal health agency. So creating nodal health agency means it is need to create a designated and autonomous focal agency with the required capacities and linkages. It is to perform the functions of disease surveillance. So the nodal health agency is mainly creating for the achieve the disease surveillance and the information gathering means for the data collections for the health impact of policies of key non-health departments, maintenance of national health statistics, and the enforcement of the public health regulations and dissemination of information to the public. So by all these things we take the steps like the assessment, planning, implementation according to the rationale, then the evaluations. This is the correct step we have to achieve. By following these measures, we can achieve the disease surveillance, means for the promotion of wellness and the prevention of the diseases. The IOG's National Health Stack is a step in the right directions which needs to be operationalized as soon as possible. The last challenge is the decentralization. So there is a need to make nutrition, water, sanitation and hygiene, that is the WASH. We know that we already heard about the WASH in case the time of the COVID-19. So WASH means it is the water, sanitation and hygienes. So we have to prevent the illness and promote the health. So we have to provide from nutrition to our body. So this is the part of the core functions of the Panchayati Raj institutions and municipalities. That is the grassroots level mechanism. So from grassroots level we have to promote the health factors. The Indian healthcare system is mainly categorized into public and private healthcare system, and the public is under the Ministry of Health, Ministry of Defense, Ministry of Railways. We already discussed that there is a challenge called the overlapping of the healthcare systems legislation or the jurisdiction. So we can see that the public is under the Ministry of Health, Ministry of Defense and the Ministry of Railways. Ministry of Health consists of the state and at the central level. In central level, it is categorized the employee state insurance, means the ESI and dispensary hospitals, and the central government health scheme, medical college hospitals and national health institutions, or the tertiary hospitals. Tertiary hospitals, it consists of the multi-specialty hospitals and the Ayurveda, Yoga, Naturopathy, Unani, that is the Ayush. So these all coming under the central government, which is under the Ministry of the Health. And in state government, it is mainly classified into rural and urban. So in rural, it is the CHSC, PHC, sub-centers and accredited social health visitors. The accredited social health visitors means example is the Asha worker, and also it includes the Anganwadi and the Kudumbashri in Kerala. These are the examples of the accredited social health activities. And also the rural level. In rural level, that staff nurses from the PHC and the CHSC also will be the participation of this program. And in the urban, that is the super specialty or the referral hospitals. The referral hospital means from the secondary hospitals, they will send to the tertiary, and from there they have the right to transfer them to the medical colleges. And the special disease hospitals. Special disease hospital means some hospital is mainly designed for the HIV, AIDS, some are mainly for the communicable disease, some are mainly for the non-communicable, and some are related to the maternity, pediatric, geriatric. So these are the special disease hospitals. And the district hospitals, then the government medical colleges, then the taluk hospitals. So these are the main categories of the public sector. And the Ministry of Defense, it consists of the dispensaries, base hospitals, specialty hospitals, army medical colleges and hospitals. Same, the Ministry of Railway also consists of the dispensaries and hospitals, but they lack the specialty hospitals and the army, because this is only exclusively for the Ministry of the Defense. And for profit, the private is for the profit and the public is for the services. For the profit, there is the multi-specialty hospital, specialty hospitals, nursing homes are there, private clinics are there. And the private is also running the non-profit, that is based on the NGO and the outreach, and also maybe religious or the non-religious. So these are the main Indian healthcare systems. Our next article is the scam fault line is damaging the Indian banking. This is relevant in GS paper 3 in Indian economy under the banking system. So before going to our topic, we basic concepts about the non-performing asset, that is the NPA. So NPA means when a person delays the payment of the loan. bank will give loan to the individuals, and individuals in return they have to pay the interest rate. So when a person delays the payment of the loan or an amount which was due on him through the delay in payment in either interest, means if he delay the interest payment or the installments or the principal amount, this will lead to the NPA, that is the non-performing asset. Differences between the bank fraud and NPA. So NPA means if the person is taking for the agricultural sector and he lost his profit or because of the natural calamities, then he will not get the profit as well as he can't pay back the interest. So this will lead to the NPA. This is not the bank fraud. So what is bank fraud? The bank fraud is different from the NPA. So NPA, it has been a bane for banks for a long time. And there have been renewed efforts on part of the government of India and the Reserve Bank of India. It is to tackle the problem of the non-performing assets. So there is a difference between the bank fraud and the NPA. Bank fraud is a criminal offence, but NPA is not a criminal offence. It is a loan or advance wherein interest or installments is remain overdue for a period of 90 days. If the payment is overdue for a period of 90 days, this is called the non-performing assets or NPA. Bank fraud means it is the criminal offence. So as per the RBI, means the Reserve Bank of India, an asset becomes non-performing when it stops to generate the income for the bank. The NPA, the interest rate, means it is the asset of the bank. So from this, the bank generate the income. So if the bank is not getting this income, it will lead to the non-performing asset. So the non-performing assets in the public banks are valued around $62 billion, about 90% of the total in NPA in India. The reasons behind the rise of NPA means between the 2004-2009, there was a huge growth in the economy which leads to firms taking bank loans very aggressively. So there was growth in the economy. If there was growth in economy, people will start investing more in the economy. So they started investing and by taking the loan from banks, and most of the investments was in infrastructure like the road, power, aviations and the steel. So laxity in lending norms by the banks without analyzing the financial health of the companies and their credit ratings. So the thing happened here is the banks lended, but they didn't analyze the financial health of the companies as well as their credit ratings. After this, it will lead to the NPA, and also the banning of the mining projects, delay in the environmental permits. Things happened here is the investments or the infrastructure. The investment was put in infrastructure like the roads, power, aviation and the steel. For achieving all these things, we need some environmental permit and also mining projects we need, and these all lead to the issues like delay in environmental permit, banning of mining projects due to the major concerns about the sustainable development as well as the environmental protections. So these lead to the rise in the price of raw materials. If the price will increase, sure it will lead to the inflations and also a big gap in the demand and supply. If the resources, the price of the resources will increase, it will lead to the price of the products. So it will rise the increasing price of the products. So the demand will reduces. So this will create a big gap in demand and supply, thereby affecting the power, steel and iron industries. So this affected the capacity of the company. So they didn't get the profit, and these lead to the non-repayment of the loans or the interest to the bank. Though it further resulted in the non-performing assets, that is the NPA. NPA is mainly classified into three categories, that is the substandard assets, doubtful assets and loss assets. The substandard asset means which is the NPA for a period of less than or equal to 12 months, that is 1 year. If a person is not paying the interest for a period of less than or equal to 12 months or the 1 year is called the substandard assets. In case of doubtful assets, where the asset is the substandard category for a period of 12 months. In the loss asset means if the bank is not getting their income through the interest means these assets are of little value. So it can no longer continue as a bankable asset. So there could be some recovery value means they will go to the court or jeopardy like measures will taken. This is the loss assets. Impacts of non-performing assets. So due to the non-performing assets, there is some impacts in our country. So bank means these have to maintain the sufficient funds for the development projects. Bank give the loan, they are not getting interest or principals or the amount back, then this lead to the NPA. So the bank won't have sufficient funds for other development projects. So this will impact the economy. Then the further infrastructure development or the further investment will not occur in our economy. So this will be an obstruction for the developing country or the developing part of the economy. To maintain a profit margin, banks will be forced to increase the interest rate. So if they increase the interest rate, people will deposit more. So then they will get the interest much. But it will also leads to the lending interest rate will be more higher. And due to the curb in further investment, this may lead to the rise of the unemployment. So these are the main impacts of the NPA in our economy. So coming to the news, more steps to prevent the frauds are needed, which include tightening the internal and external audit systems of bank. So audit means it is the analyzing of the working of the banking system. So we want to prevent the frauds. Bank fraud means if we take the adequate measures, then we already discussed that, then we can check the credibility of the companies and also their financial health. Then we can prevent the such circumstance like the bank frauds and also the NPA. The biggest banking scam in India has come to the forefront in the midst of the celebrations of Azadi Ka Amrit Mahotsav. In this case, Devan Housing Finance Corporations Limited (DHFL), it had hoodwinked a consortium of banks driven by the Union Bank of India to the tune of 35,000 crore through financial misrepresentation. So other than the DHFL case, there was also a ABG Shipyard Limited of Surat is already there. It had taken a loan about 23,000 crore in a fake manner. So these are the examples of the fraud cases. So in order to prevent this, we have to tighten the internal and external audit systems of our bank. On February 1, 2019, a consortium of banks had held a meeting to take the cognizance of the serious allegations of loan repayment default against the DHFL. And also a core committee of 7 of the largest banks were formed: the State Bank of India, Bank of Baroda, Bank of India, Canara Bank and the Central Bank of India, Syndicate Bank and the Union Bank of India. This was formed. And the KPMG, it is a global network of professional firms which is providing the audit, tax and advisory services. Also, there was a first information report, that is the FIR, which it have been reported by the CBI, that is the Central Bureau of Investigation. It shown that the State Bank of India was the most badly hit with a non-performing asset. It is about 9,898 crore. It is affected by the State Bank of India, and the various sum the DHFL acquired from it. So DHFL is the most important issue that is affected by the State Bank of India. So essentially the Bank of India and the Canara Bank have been plundered to the tune of more than 4,000 crore each by the DHFL. So in order to tackle all these things, we have to maintain the internal and external audit. Also, more than 3,000 crore each has been supposedly cleaned up by the DHFL from the Union Bank of India and the Punjab National Bank. So in short, the DHFL, because of the DHFL, the banks affected are the State Bank of India, Bank of India, Canara Bank and the Union Bank of India. We know that banking system of any country, it is the backbone of its economy. So if we lose our money in means of the non-performing assets or the bankrupts, it will further impact the citizens of the country, means can't trust the banking system, as well as they can't manage or they can't introduce new development infrastructure projects. So this will adversely affect our economy. And there was a data by the Reserve Bank of India. It shown that around 34% of the scams in the banking industries are on account of inside work, which is due to the poor lending practices. That is, they will not check the credibility rate, and also they will not analyze the financial health of the companies. So this is the involvement of the junior and mid-level management is there. They are not escalating the issues to the senior level, and this all lead to the further complications. And also the RBI shows that one of the fundamental problems in the way of the development of banking in India is on account is the rising of the bank scams, and the cost is consequently forced on the framework. So strangely, the Global Banking Fraud Survey KPMG showed that the issue is not just for India alone, it's a worldwide issue. So the NPA issue and the bank fraud, this is a issue which is covered in the whole world level. This is not only for the India. NPA projection A list. Certain list of NPA are there in a financial stability report. So the financial stability report which is released by the RBI, that is a financial stability report. We have to remember this. This is important for the prelims. That is, it is released by the RBI in December 2021. It shows that there is a projection of the gross NPA for banks which rising from 6.9% to 8.1%. So from September 2021, it was 6.9%. It increased to 8.1% in September 2021 of total assets by September 2022, and to 9.5%. So it increased to September 2022 to 9.5% under a severe stress scenario. And the frauds in the banking industry can be grouped under 4 classifications. So the frauds in the banking industry can be classified into 4 classifications. First one is the management, outsider, insider and outsider jointly. So these are the main classifications of the banking system fraud. First one is the management, outsider, insider, and both the insider and outsider. All scams, whether interior or outside, the results of operational failures. So if the scams are from interior or from the outsider or from jointly, means both from interior or outsider or from the management, all these results of the operational failures. Deloitte, its research conducted by, is shown that the limited asset monitoring after disbursement, that is 38%, was the foremost reason behind the stressed assets, and insufficient, which is due to diligence before the disbursement, that is 21%. It was among the major factors of these NPAs. There are news reporters every few weeks of some fresh or new banks, means it is a recurring process. Today some bank issue will come, means like NPA or from majorly fraud cases are coming. So the next week it will again come, and further it will increasing. So the day by day these issues are increasing. So which is breaking the trust of the common man in the banking system. So we can't trust our bank. Then how we will deposit our money into the bank? We will not feel secure there. So there are examples of the bank systems are there. So some of the examples are the Nirav Modi, Mehul Choksi, and also they involving in the Punjab National Bank, and also the Vijay Mallya. It's a famous case, and also the Andhra Bank fraud, and the lots of cases are there. Hyderabad bank fraud, syndicate bank scam, and also the Bank of Maharashtra, IDBI. Lots of systems are there, lots of issues are there related to the fraud cases. PA, it will affect the bank. So they have to meet their expenses and they have to maintain a interest margin. So they will increase the fee or the interest rates from their small customers on a day-to-day basis. So this will adversely affect our people as well as our country. If the bank increases their interest rate, people will deposit more, but further it will also lead to the increase in the interest rate of the lending, or the lending rate will be increased. So this will affect the further infrastructure development as well as the investments. So there was a data published by the RBI. So according to the RBI data, the corporate loans which account nearly 70% of these bad loans, while Retail loans. The retail loans which consists of or which includes the car loans, home loans and the personal loans. It accounts for the 4%. And also there was a study which is conducted by the Indian Institute of Management Bangalore. It showed that the major issues or the reason for the rising bank scams and the NPAs mainly because of the poor bank corporate governance. So poor bank corporate governance is the major issues, the major reason for the rising of the bank scams and NPAs. So this is the end of today's discussions. I hope you all got it and thank you.